Already the organisers have put on a fantastic event. I'm grateful for the opportunity to say something about this important topic and to share a space with the other speakers too. I haven't seen Ishmael since we both volunteered with Cosmic Care at Boom Festival many years ago. That was back when I was a student myself, and I was president of the UKC Psychedelic Society at the time. That kind of harm reduction work that we did at Boom Festival has really been invaluable to me going forward. And I would really encourage anybody who's interested in becoming a clinician or working with psychedelics or any drugs that are used recreationally to get involved on the ground in initiatives like Cosmic Care, Psycare, or TTK Welfare. Of course, that's as soon as festivals are back on everywhere. So I'm now part of the Conservative Drug Policy Reform Group, the CDPRG. We're a group that collates the research and evidence on the suitability of current drug legislation, metabolizing and delivering it to the right people in government at the right times to effect changes in policy that will increase public good. We're chaired by a Conservative politician, Crispin Blunt, but are otherwise unaffiliated with the party. The C in our name indicates that our target audience is the centre right, being the demographic found to be most adverse to drug policy reform. My personal role within the organisation is the Psilocybin Rescheduling Project Manager, and I'm going to give a brief introduction to that campaign, nesting my work within the question, what does the road to legalising psychedelics look like? The point I want to make is that the road to legalising psychedelics does not exist. The road to legalising psychedelics is being built as we go. And it is important that we stop to smell the flowers every so often, appreciating how far we've already come and assessing how best we can proceed. There is evidence to suggest that psilocybin is a compound with the potential to revolutionize the treatment of myriad mental health conditions like depression, post-traumatic stress disorder, anorexia, and addictions by facilitating psychotherapy. But this research is still scant. Sample sizes are small, and for such a promising substance, modern clinical studies, especially those that have been completed and published, are few. There is, of course, a reason that there is not more evidence available at this current time. That is that psilocybin finds itself alongside many other substances with medicinal potential, including other psychedelics, in Schedule 1 of the Misuse of Drugs Regulations 2001. This status implies that psilocybin has no medicinal use and is harmful to the user. The researcher looking to study psilocybin or any Schedule 1 substance, be it experimentally in animals or clinically in humans, is required to obtain multiple licenses. Dr. James Rucker required 6 separate controlled drugs licenses, which cost over £20,000 before any patient was able to receive psilocybin on his clinical trial. One of these licenses was required for a pharmacy, which did nothing more than bottle the psilocybin capsules. Of course, a further license was required to transport this bottle of capsules to the location of the trial. If that was not enough, Professor Joe Neal's controlled drug license for animal research took over a year to obtain due to Schedule 1 associated reams of red tape. The increased stigma, costs, and duration incurred by a substance's Schedule 1 status is prohibitive to researchers looking to study these drugs. In essence, the scheduling of these drugs is, according to the evidence, unjustified, and while ostensibly protecting the public and regulating research into dangerous drugs, is actually deterring researchers and keeping them from amassing the evidence that would call this scheduling into question. Just to be clear, these same restrictions are not shared by drugs known to be more harmful, such as heroin and cocaine, which find themselves in Schedule 2 already. A legal, regulated market of psychedelics has not been achieved anywhere. It has never been done before, and how exactly it will be achieved is pure speculation. In terms of psychedelic research, we have already come so far and achieved so much. We know more now than we ever did previously. Every new study in this area is groundbreaking. Research with psychedelics is pushing the frontiers of human knowledge. It feels like the sky is the limit, but we need to keep our feet on the ground. We should enjoy walking down the road ahead, carefully assessing the path of least resistance, rather than charging ahead to legalize psychedelics. There is danger of psychedelic exceptionalism, that is, legalizing our drugs and not legalizing their drugs. If any drugs are to be legalized, all should be. And as much as this seems to be a valiant and sensible goal, politically speaking, it is just not that easy. Of course, there are fantastic documents coming out of Transform, for example, on how to legalize stimulants and soon on how to legalize psychedelics. But these do strike me as, at the current moment, seeming a little bit idealistic and almost utopian. The fact is that we have a conservative government in power now, and at least for the next few years, we must navigate the path accordingly. One cannot simply ask the minister to legalize psychedelics, let alone all drugs. We must play it relatively safe and move relatively slow to avoid the pitfalls of the past, like the evangelizing of the 1960s and also the gold rush profiteering of the cannabis space in North America more recently. Being in touch with the emerging evidence, as well as with people from all walks of life, whose lives have been literally saved by this seemingly magical substance, psilocybin, and others, it's hard not to be astonished at just how much potential there is. But the people with the power to make legislative change are just not aware of the ethical urgency of drug policy reform. The change of government every handful of years, as well as internal party politics, means that ministers and officials to whom the evidence could be presented are not consistently present. The elders of the drug policy reform community know this all too well. They repeat the same arguments and present more and more evidence to different people every few years, and little change actually happens. There is no lack of evidence indicating that a total reconsideration of UK drug policy is entirely justified, but every time there is a governmental change, there is an entire set of new people to convince from scratch. This is why it's important to address these issues in increments. Simple arguments for simple reforms repeated. Simple arguments for simple reforms repeated. Legalizing psychedelics is important, and we will get there, but I, for one, do not yet know strategically how. What is important is that we take our time to do it properly. It's important that we do collate the evidence, both anecdotal and statistical, assess risks and formulate models for what legal markets may look like. For now, we should concentrate on the first step. Of course, I'm going to say that's having psilocybin rescheduled, opening the door not only for more research and access, but also the rescheduling of further psychedelics. Once rescheduled and evidence is collected and stigma is reduced, once more people hear the word psychedelic without instantly associating it to trying to fly, going mad, or dropping out of society, then the road ahead may become more clear to see, and the next part of the strategy to bring drug policy reform and public good can be conceived. I want to make sure also that along the way, we do not forget that these substances are more than just medicines. For some, they are sacraments. For others, they are tools for doing philosophy or increasing productivity, for doing parapsychological research and consciousness research, and even just for having fun. The road to legalization looks long, leading over the horizon and further than any of us can see. I say, let's take it one step at a time, addressing the issues we are confronted with now. We have to walk before we can run. We have to conduct robust research. We have to combine all the evidence. We have to assess other models, and of course, take account of the very real risks of making such powerful substances available to the public. Without doing so, we run the risk of tripping ourselves up and slowing ourselves down. I'm very grateful to be able to play my part in seeing psychedelics legalized one day, if only by trying to help facilitate what appeared to me to be the first initial steps. Thank you very much.